All right, let's jump right in. Today, we're going to unpack something really important: India's massive plan for taking care of its seniors. We're talking about the National Program for the Healthcare for the Elderly. You'll hear it called the NPHCE. So, to really get why this program matters so much, you have to look at the bigger picture. India's elderly population is growing incredibly fast. And that brings up this huge, unavoidable question: how on earth is the country's healthcare system supposed to keep up? So, a program this huge doesn't just pop up out of nowhere, right? It's not like someone just had a good idea one morning. Let's dig into the foundation it's built on, because that tells you everything you need to know about its mission. Yeah, this program has some serious muscle behind it. You can see here, it's standing on a solid bedrock of major commitments. You've got global standards like the UN Convention. You've got India's own national policy on older persons from way back in '99. And then there's that super important 2007 law on senior citizen welfare. So the NPCHE isn't just a suggestion, it carries real legal and ethical weight. Okay, so every big plan needs a vision, a North Star. And believe me, the NPHECE has a truly ambitious one. Let's break down what it's really trying to do for every single senior citizen in India. And here it is. This is the core promise. Those three words are just so powerful: accessible, affordable, and high quality. See, it's not just about providing some care. The goal is to provide care that's complete, that people can actually get to and afford, and that actually works. I absolutely love this phrase: creating a new architecture for aging. It just captures the whole spirit of a thing, doesn't it? This isn't about slapping a new coat of paint on old systems. No, this is about designing and building something totally new from the ground up, a whole support structure. And finally, and this is so important, it's not just about treating people when they get sick. The vision is way bigger than that. It's about promoting active and healthy aging. The whole idea is to be proactive, to help people stay well and live full lives as they get older. That is a game changer in how we think about elder care. Okay, the vision is powerful, for sure, but how does it actually work on the ground? Let's get into the blueprint and see how this whole ambitious plan is put together. The whole system is basically a pyramid of care, which makes a ton of sense for a country as huge as India. At the very top, you've got the heavy hitters, the national and regional geriatric centers for really specialized, complex stuff. Step down a level, and you find dedicated 10-bed wards in district hospitals. And then, forming the base of the whole thing, you've got care built right into your local community and primary health centers. This setup brings everyday care close to home, but keeps the specialists ready for when you really need them. A great structure is one thing, but you need the right tools for the job. So what services are we actually talking about here? Let's open up the NPCHE toolbox and take a look inside. I mean, just look at this list. It shows you just how complete the services are meant to be. It is a full spectrum. It starts with promotional stuff for good habits and preventative care to stop you from getting sick in the first place. Then, of course, you've got curative treatment and rehabilitative services to help you recover. And what's absolutely crucial, domiciliary care. That means they bring support right to your front door. It really does cover all the bases. So how do they actually deliver all this? Well, this table lays it out pretty clearly. First, community-based care. That means home visits from trained workers. Second, dedicated facilities, so special clinics and wards just for seniors. Third, capacity building, which is a fancy way of saying they're training a lot more doctors and nurses in how to care for older people. And last but not least, a whole lot of information, education, and communication to get the word out. Okay, that's the plan. It sounds amazing. But how do we know if it's actually working? Let's look at the real-world goals and the outcomes they're aiming for that will really define whether this program is a success. And this is key. We're not talking about vague promises here. The NPCHE has very clear, concrete targets for building out this new healthcare architecture. So let's look at some numbers to really appreciate the scale of what they're trying to do. At the very top of that pyramid we talked about, the goal is to strengthen 8 regional geriatric centers. Now, these aren't just hospitals. Think of them as the national centers of excellence for the most difficult cases, for advanced training, and for cutting-edge research. But having amazing centers at the top doesn't help if people can't get to them. And that's why this next number is so vital. The program is aiming to equip 100 district hospitals with their own dedicated geriatric units. That's a massive step in bringing expert care much, much closer to where people actually live. And this isn't just a token gesture. To make it even more real for you, each of those 8 top-level regional geriatric centers is going to have a dedicated 30-bed ward. That number represents a huge long-term investment in serious inpatient care for older adults who need it most. Now, here's one of the smartest parts of this whole program. It's not set in stone. It has a built-in brain called Lossy. This is a massive, ongoing study that tracks everything about the lives of older adults, their health, their finances, their social lives, and all that data feeds directly back into policy, making sure the program keeps evolving to meet what's actually happening in the real world. So as you can see, the NPHCES is an incredible blueprint, but the challenge is just immense. It really leaves us with this one big question to think about. With one of the fastest growing elderly populations on the planet, how is India going to keep innovating on this framework to secure a healthy future for all its citizens?